Guys, welcome back to Medical Coding with Blue. Today's episode is all about, is the U.S. Career Institute a good program to learn medical billing and coding? If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So I got 2 comments about this very school, this very program. So here we go. The first one says, "Hi, I am a nurse and planning to take a course at the U.S. Career Institute for medical coding. Do you think this is a good choice?" And another person commented right underneath them and said, "I have the exact same question for coding and also for the medical assistant course." So here's the thing, guys. First of all, this is my opinion on this program. All right. My opinion. And I will never steer people to pay more than they need to, or to do things that are not going to benefit the coder. All right. That's first of all. And you all should know that. Being anytime that you've watched my channel, you all should know I am for the coder. All right. Number 2, they are not paying me to talk about them. Okay. So this is going to be a real and genuine thing. It's not an ad for them. If you choose to go through them, that's your deal. What I'm going to do today is I'm going to explain what I see that they're offering, and whether you choose to go with them is entirely up to you. People have asked me so many times, what is my recommendation to learn medical coding? I have always said you can go directly to the associations themselves, AHIMA, the American Health Information Management Association, or AAPC, the American Academy of Professional Coders. Both of them have their online medical coding program. AHIMA is a little bit harder to get to. I really wish they would fix that, because AAPC really does a really good job of having it right in your face as soon as you go onto their website. Somebody even told me, "Oh no, it's not there." I know you didn't look at the website, because literally when you go to AAPC, that is the first thing that they will ask you is, are you ready for your new career in medical coding? They'll start giving you all those options. So guys, go to the websites. Those websites will be in the description box below. So you can learn either from the associations themselves, that's what I recommend, or you can use my independent study list. Again, that is in the description box below, and it has all of the books that you need. I don't ask people anything for this. It's just information that I have out there. So the description box of the independent study video has all the books that you need to study. All right. So if you are wanting to do it that way, you can absolutely do it that way. The thing about learning medical billing and coding is that you don't have to go through a formal program to learn this at all. You can just learn it on your own, or you can learn on the job and then take the certification exam. It is very important to take the certification exam, because this says that you are competent. And that you've been tested through one of the associations about medical coding. So again, it's very important if you want to be taken seriously. I'm just saying. And the other thing is this. You may hear that a program is accredited. Oh, is this program accredited? And then they say, oh yes, we're accredited through this association, that association. That doesn't matter when you're going to medical coding school. What matters is completing your program, being competent enough to take the certification exam, either through the American Health Information Management Association or the American Academy of Professional Coders. Either one of these. These are who employers are looking for. Their certifications are what matters, okay? So whether you go to a program that's accredited for medical coding, not the degree programs. I'm not talking about degree programs, because that's something different. You do have to go to a specific program for those degree programs. But for the coding part, no. You can learn on your own, or you can go directly to the association websites. Now, the other thing that I will say about this, I'm saying quite a few things, but there's quite a few things to go over here. So sometimes people get vouchers to go to these schools, right? I know that the U.S. Career Institute takes the GI Bill. They also take the MyCAA for my military spouses, right? Who can go through these programs. They have like a list of all these programs. And then they say, well, you can pick whatever school you want to go to, and we'll give you a voucher to go to that school. If that is the case that you're in, that, you know, that's how you're able to pay for this school, and this is the only choice that you have, by all means, go through it, you know, and you can learn from it what you can. You can also supplement your learning with the independent study video, again, in the description box below. you can use that to supplement your studies, because this program, from what I've seen and what I've read so far, I'm going to read some of this with y'all too, and I'm going to leave this link in the description box below. This program with U.S. Career Institute for Medical Billing and Coding, it allows you to be, to complete the program within 5 to 12 months. So that tells me already that's a good amount of time. But they do kind of like emphasize that, oh, you can get it done in 5 months. I do not recommend completing this program in 5 months. You will not be ready. It doesn't matter if you have a medical background, if you've been a nurse, it doesn't matter. It's a lot to learn, guys. When you're trying to learn medical billing and coding, you are not just learning one book. You are learning 3 at a minimum, because this program teaches only the outpatient coding. This does not teach the inpatient side, which is the ICD-10 PCS and all that other stuff. It does not teach that, according to this, the way that this program sounds, because they say that they are preparing you for the CPCA or the CBCS. Now, we've had this discussion before about how I feel about the CBCS. I will say this, and if you're going to get your feelings hurt, guys, again, my channel, I'm going to tell you the things that I see. When I look at these job listings and they're asking for certain credentials, I am going to talk about the ones that the employers want. They want their coders to be certified through the American Health Information Management Association. That's the CCS, the CCA, or the CCSP, or they want them to be certified with AAPC, the American Academy of Professional Coders, and that's the CPC. They want that flagship credential from AAPC. Any one of these 4 that I just said is what employers are looking for. When it comes to the CBCS, that is through the NHA. That is something completely different, and that is not what employers are looking for. Now, up until about a year and a half ago, maybe 2 years now, they actually didn't require books to sit for that CBCS. Why? Because it's primarily a memorization test. It's like a billing test. So up until about a couple of years ago, they didn't require you to have medical coding manuals to take that test. And literally, the CBCS is Certified Billing and Coding Specialist. It has billing and coding in the name, but it didn't require you to have your books, the ICD-10-CM, the CPT, or the HCPCS. It did not require those. Now it does. It does now. But again, when you're taking a test that literally has billing and coding in the name, you would think that it would be important to have those books, because that's exactly what you're going to be working with. Even as a biller, you're going to be using ICD-10-CM, the diagnosis codes, CPT-4, again, your procedure codes, HCPCS, and that's like your durable medical equipment, and additional procedures that are not covered in the CPT manual. So that's something that you have to know. There's a lot of double talk in the industry about, oh yeah, if you have multiple credentials after your name, employers are going to want to hire you and you're going to make more money. No, you won't. No, you won't. Because if you look in the job listings, all you're seeing them ask for is 1 certification. Just 1. Just 1. So for my new people, especially those with the CPCA, right? Don't get trapped into, oh, you need a bunch so that you can get hired right away, because it doesn't matter. All of those additional credentials that are trying to push on you, they're typically already rolled into that CPC credential already. Like the billing, the CPB. You're tested on reimbursement with the CPC. The CRC, that's the risk adjustment coding. That's diagnosis coding. You know the diagnosis coding is already covered in the CPC exam. So that's what I'm saying, guys. You don't have to flood your name with all of these credentials that it's already testing you on that one. Because it's more money. It's more money that you're going to have to spend. And so many people get wrapped up into that. They're willing to spend all this money just to try to get in. What you need to do is get focused on your education, what you know, you're learning, and being proficient with medical terminology and your anatomy. So with that being said, I know all that, right? Here's the thing with this program. It says that you can complete it in 5 to 12 months. It's self-paced. The CBCS certificate, the voucher to take that test, is included with this program. Again, guys, you don't need it. You don't need it. But they do say here that they have an 83% pass rate versus a 74% national average. Again, it is mostly a billing test, okay? Program goal: to prepare students to take the certification exam of their choosing and gain entry-level employment as a medical billing and coding specialist. And then the coursework trains students to apply theory and practical skills, to assign diagnostic and procedural codes to medical records according to coding guidelines, integrate medical terminology, human anatomy, physiology, and disease process with medical coding and billing systems, apply theory and practical skills to work in medical billing, implement the essential skills of medical billing, electronic claims submission, and insurance form completion for medical service providers, and then apply effective medical ethics and legal theory in your career. And then the curriculum. It doesn't say on the website what books that they do give you. However, I think they're electronic books, because they say that you can order like the hard copy of your books for like around $50 a piece. So I don't know how many books they do require for this program, but they are saying the curriculum has in the instruction pack 1, introduction to medical coding and billing. Students explore the roles of healthcare professionals. Additionally, students discover the role of medical records and how they play in the coding and billing specialist job, and gain understanding of electronic records. They learn medical terminology using a unique word building system to help them interpret new terms. After examining important ethical and legal issues they may encounter, students build on their medical terminology knowledge within each body system. Instruction Pack 2, medical billing. Students will learn about the history and development of healthcare reimbursement. Students gain an overview of private insurance, managed care, and government programs, as well as the details of military insurance and workers' compensation. Students get extensive hands-on practice completing the CMS 1500 form and completing explanations of benefits, as well as completing secondary claims. Students will then explore how to deal with insurance basics, denials, and aging. Finally, students will learn to complete a claim using a cloud-based medical billing software. Instruction Pack 3, the diagnostic coding. Students will learn the basics of anatomy before diving into the specifics of ICD-10 coding manual. The students examine the structure of ICD-10 coding manual, as well as the guidelines and rules of ICD-10-CM coding. Additionally, students integrate diagnosis coding processes with physiology knowledge, from infections to disorders of mental and pregnancy. Students also begin coding symptoms, ill-defined conditions, injuries, and poisonings. Students use the ICD-10-CM coding manual to complete the course. And then Instruction Pack 4 is procedure coding and code integration. Students apply their anatomy and diagnostic coding knowledge to Instruction Pack 4, which focuses on the CPT. Students gain the instruction to the HCPCS coding manual and coding rules. Students learn about the sections within CPT and integrate the diagnostic and procedure codes. Students use the CPT manual to complete the course. And then Instruction Pack 5 is evaluation and management services in the final exam. Students learn how and when to use the evaluation and management codes in their final pack. They complete a final exam, giving them an opportunity to apply outpatient coding skills. So that is the overview of their program. Again, it doesn't tell me what books they're going to give you, or any of that kind of thing. Let's see. But under the career and certification, it says that the CPCS certification is included in the program, but that a career in this field may require you to meet certain licensing, training, and other requirements that can vary by vocation and state. When you get certified through the American Health Information Management Association or the American Academy of Professional Coders, it's good everywhere, okay? It is good universally, all right? You should check with your state or local government and or licensing board to find out what are the requirements applicable to your state. So the CPCA exam is the one that they're preparing you for, and then the CPCS exam. So when you click on it, requirements, AAPC membership, and exam fees recommended. So see, they're not, they don't, it doesn't sound like the membership is included, because you have to be a member of AAPC in order to sit for their certification exams. Just saying. Recommended: a certificate or transcript showing 80 hours or more of education can be used to fulfill one of 2 years required to remove the apprentice status from the certification to become a CPC. So after a year of verifiable coding work experience, the grad can apply to have the A dropped by submitting a letter on letterhead, and then a signed letter from your employer verifying 1 experience of on-the-job experience. So that's that part. So it doesn't sound like those your tuition and everything covers AAPC fees. So that's something that is completely separate. That's something you have to pay on your own. What else was I going to say? So for that, with that in mind, I mean, again, if you are in the program, they have like monthly payments that you can do, and then they have like a cash if you pay it in full. It's $1,869 if you pay it in full. If you're going on an automatic payment, if you're going out of your pocket, it's $2,269. So that's like the monthly payment is $79 is what it says. So, and then it says plus a one-time $29 application charge. First payment includes a $50 down payment and a $25 application charge. Application charge is non-refundable. So, and then it talks about the hard copy lesson books. Here at U.S. Career Institute, we teach to a classroom of 1, and we know that no 2 students are alike. Therefore, hard copy lesson books are available for under $50. If you prefer hard copies of your materials, you can easily order them online or by phone after enrolling. And then it talks about like the military and the VA benefits. So if that's you and you're in that situation where like this is the only option that you have, I mean, you can certainly go through the program if you want to. Again, I don't know what specifically like the breakdown is. They didn't really give that. They just gave just like a broad stroke of what they have there. So it's up to you. I mean, if you want to do it that way, you totally can. But I will say this, that medical coding is something that you learn very independently. So if you're looking for, hands-on instruction and things like that, this doesn't sound like that, okay? Because they say it's self-paced. So it doesn't sound like there's an instructor either. So you're kind of learning on your own. Now you can learn this on your own. It is possible to go through a program like this and still be successful. You can find a mentor or find a tutor. If you find a tutor, you're gonna have to put out a little bit of money for that. But it's okay, because I think sometimes we just need somebody to explain things to us. There's a ton of tutors on LinkedIn. You can certainly go to LinkedIn and put a post that you are looking for a tutor, and that if anybody has any recommendations, I'm sure there's going to be plenty of people that will tell you about different tutors that they know. I am a tutor myself. My rate is in the description box below. But one thing before I wrap this up. So we're clear. If you want to go through this program, it's entirely up to you. I do believe they're part of the Better Business Bureau as well. But I will say this, if you're thinking, oh yeah, I need to get a medical assistant and everything else, you don't. Don't go studying medical assistant unless you want to be a medical assistant. If you want to be a medical assistant, then don't pursue medical coding, because they're 2 different things, guys. And they're going to go down 2 different paths. If you want to be hands-on and with the patients and everything, then medical assistant may be for you, if that's what you want to do. But if you want to be in an office setting where you're not having to deal with patients, unless you're doing the billing side. But if you're just doing the coding side and you just want to just do the reading, you want to work with the providers and that kind of thing, then the medical coding is right for you. But don't think that you need to add on, oh yeah, I'm studying medical coding and I'm also studying medical assistant, because you just need to do one, guys. You don't want to have so many things attached to your name. And like, if you go and apply at a place, right? And you say, oh yes, I'm a medical assistant. And oh yeah, well, I have my medical coding certification. Oh, so you never know the place that you may work. Like if you're working for a small doctor's office, which I recommend not doing, especially if you're a brand new medical coder. But if you decide to go that way and they see that you're both a medical assistant and a medical coder, now you're going to be pulled at both ends because they're going to want you for the coding and they're going to want you for the medical assistant. So you need to make up your mind and decide on one, because your devotion to either one is important. If you want to be a really good medical assistant, then go the medical assistant route. If you want to be a really good medical coder, then go the medical coder route. How do you know? Well, you don't know. You're not going to know that you fully will enjoy this career field until you get into it. Until you get into it, and then your attitude towards challenges, because you will have lots of challenges in the beginning. There's going to be a lot of people that will tell you no when you first start, when you're trying to apply for these jobs. And you see that a lot of them want 3 to 5 years experience. And I tell you guys to go ahead and apply anyway. Arm yourself with a good resume, a good cover letter, and get out there and be positive and be proactive. And don't just sit there and wait around to say, the job listing to say entry level, because they never will, guys. They never will. All right. So be proactive, get out there, get registered with a temporary agency. That was how I got my first start. Every place is different. There's no universal thing. So you can Google in your area where to find temporary agencies for medical professionals, and that's what you look up. And so that can help you there, guys. But learning medical coding, I will say this and I will say this again and again. We have to know what doctors know while never having gone to medical school. While there are some really great schools out there, I don't know them. I know what I know, and I went to a trade school, vocational school, whatever you want to call it, that's no longer there. And they literally sat me in front of a computer and told me, here, learn. And that's it. You know, so you have to be willing to learn on your own. This is not something that people are going to hold your hand, guys. They won't. And you have to be expecting that. Now, you may get lucky and you may find people that are willing to help you. And if you do, treat them well. Treat them well, because there's a lot of people that just want to take advantage of people who want to help. Okay. So just keep that in mind when you're out there and you're trying to decide on this. Again, it's very independently learned. If you get into this program and it's not fully helping you to learn everything that you feel you need to know, look through my independent study video and look through that syllabus list and see if you can find something in there that will help you. I have my book recommendations that I recommend all the time that really help. It helped me when I was studying, so it's exactly what I'm going to pass along to you guys. So take the time to look through my videos. I have tons of advice videos, tons of book review videos, tons of tip videos if you are a busy adult and you need to figure out how to set up a study schedule so that you can fit in 20 hours of studying per week. Because yes, you can. If you work a 40-hour, oh no, Blue, I work for 40 hours a week, I can't do that. Yes, you can. If I can do that and a ton of other people who are really enthusiastic about learning can do it, you can do it. I'm just saying. So if this video helped you, I hope that you will like, subscribe, and share, and I will see y'all next time. Bye.